Thank you and good afternoon. So today we're reporting on the three periods over the past weekend. From Friday to Saturday, we had 545 new cases of COVID-19 diagnosed in British Columbia. From Saturday to Sunday, an additional 532 new cases. And in the last 24 hours, 385 new cases diagnosed in British Columbia, for a total of 1,462 new cases in the past 3 days, 19 of whom were epidemiologically linked cases. So that brings our total to 84,569 people in British Columbia who've been diagnosed with COVID-19. Of the new cases, 407 were people in the Vancouver Coastal Health Region, 802 are people in the Fraser Health Region, 72 people in Vancouver Island Health, 79 people live in the Interior Health Region, and 102 were in the Northern Health Region. We now have 4,854 active cases, and 240 people are in hospital, 66 of whom are in critical care or ICU. We now have over 8,723 people under active public health monitoring across the province, and 78,237 people who have passed their infectious period and recovered. Sadly, over the weekend, we had 11 people who died from COVID-19, bringing the total number of people who have died in British Columbia to 1,391 since the pandemic started. And our condolences, of course, go to the families and the care providers in our communities who've lost loved ones again this weekend. We have one new health outbreak in a long-term care home in the Interior Health in the Cottonwoods Care Centre, and this is a home where all of the residents and staff had been offered immunization and a very high uptake of immunization, and some of the cases are in people who had received 2 doses of vaccine. And this serves to remind us that while we are very confident that vaccine is very effective and prevents particularly severe illness and death, it doesn't necessarily mean that all transmission will be stopped, and we need to be mindful right now, when we still have high levels of transmission in our communities, how important it is to continue those precautions, particularly with older people and in care homes. On a positive note, the long-term care outbreak at Royal City Manor has been finally declared over, and that is a huge relief, I know, to the families who have people and to the people who are living in the Royal City Manor. As well, the SFU Childcare Centre outbreak has been declared over. So that leaves us with 10 active outbreaks in long-term care, assisted living or independent living, and 8 in acute care units. And right now we have about 194 residents and 112 staff in long-term care involved. We also talk about updating on the variants of concern. There have been, over the past few days, 144 new COVID-19 cases that have been determined to be cases that have a variant of concern. So this brings a total of 394 people who've had the whole genome sequencing to determine that they carry one of these variants. 87 of those people are now are active cases, and the remaining are people who are no longer in their infectious period or have recovered. The majority continue to be the B117 variant that's associated with the UK. 363 cases are that, and 31 are the B351 or 1351 that's been associated with South Africa. So still a small proportion. The majority of these confirmed cases are in the Fraser Health Region, where we are continuing to see the majority of transmission. So 303 are in the Fraser Health Region, 74 in Vancouver Coastal Health, and 6 in both Island Health and Interior Health. The trend continues in that about a quarter of these cases we do not know exactly how they were transmitted, which tells us that these variants are some of the viruses that are being transmitted in our communities now, particularly in the Lower Mainland. On a more positive note, on our vaccine update, we are continuing with the increased shipments of vaccine that we received last week and even more this week. Over 333,327 doses of COVID vaccine have been administered in BC. The majority of those now are, of course, our first doses, and we remain at about 86,925 second doses. And today, vaccine appointment bookings open for people over age 90 and for Indigenous peoples over age 65. We know that the appointments are available in multiple locations around the province starting next week, and those clinic places have been posted in all of our health authorities. And we know there has been extremely high call volumes today, and teams are working to respond as quickly as possible. While I'm grateful to see the enthusiasm that we have, we ask everyone who is outside of the age groups for this week to please be patient and wait your turn. We know that there will be time for everybody, and everybody will get their vaccine as soon as we can arrange the appointments. Calling this week, if you're outside of these first age group, will not speed up your turn, but it may cause more delays for people trying to get appointments for their loved ones or for themselves who are in this first phase. We can all do our part by waiting our turn and not calling multiple times. In terms of vaccine as well, we know we have increased shipments of Pfizer. That was announced on Friday. We'll be receiving more of the Pfizer-BioNTech vaccine in Canada and here in BC in this month of March, and that is very good news. And we are expecting our shipment of the AstraZeneca Serum Institute of India vaccine to arrive in BC in the next day or two. And as you know, we've talked about the importance of using these increased volumes right now to address where we are seeing significant outbreaks and community transmission. And one of those areas that in Northern Health that will be addressed in the coming days is the ongoing transmission and increasing cases in Prince Rupert. And in addition, the health authorities are working at identifying some of the large workplaces where we are seeing ongoing transmission and transmission that affects people in our communities, particularly on the Lower Mainland, and we'll be addressing those in the coming days. Our goal throughout our 1 year now of this pandemic has always been to have as much as is safe open, while also protecting those who are highest risk. And now with our vaccine programs taking off, that protection is so important and allows us to think ahead to where we will be in the next phases through the next few weeks and months until we get to that point where we can start moving into our post-pandemic world. It is likely we are still going to have to deal with the virus that causes COVID-19, but we will be in a much different place by the time we head to the summer. As part of what we have been doing all along, we regularly review the orders, the PHO orders that we have out, to make sure that restrictions that are in place to determine whether we can safely ease these restrictions. And this is something we've been paying a lot of attention to in the last few weeks. As our immunization program ramps up and our days are getting warmer once again, in the weeks ahead, we can start to look at this modified return of some of the activities that we have been on pause for the last months of winter. We're not going to rush to get things open, but we will take a thoughtful, careful, and phased approach over the next few weeks. I like to think of it as slowly turning up the dial again rather than flicking a switch, because we know that we're not yet in a place where we can go back to our pre-pandemic gatherings. We know as well, we've learned as we go with this pandemic, and that is the joy of science and the challenge with science, that as we're learning, we know that some things can be more dangerous, more risky in some situations than others. But we also know, and it continues to be true, that outside is better than inside. Bigger spaces are better than smaller spaces, and our layers of protection will still be needed and still work, even with the increasing numbers of cases caused by more infectious variants. And as we head into the spring and summer, we know that the transmissibility starts to fade as well. These principles will be guiding our decisions in the coming weeks in terms of what we are able to ease and when, and what we are looking at as we head into March break or spring break at the end of this week and into next week. Is seeing the return of things like gatherings outside where it's safer, activities outside that we can do in groups with precautions in place, small groups that we can do for games and summer camps or spring camps, and safe small groups with masks and safety precautions in place. As well, we'll be looking at how we can travel and explore during March break as a family or a small group together with our household, exploring our own region and making sure that if we are going to different parts overnight within our region or within the province, that we do make sure that we're not going to places that are not yet ready to receive visitors. The risk is different in different communities in this province, and we need to be mindful of that even as we increase our outdoor activities. As well, in the coming weeks, we hope to see the return of sports and religious ceremonies. Throughout the pandemic, we've been in regular dialogue with faith leaders, and I am so grateful for that opportunity to speak with them on a regular basis and to understand the concerns and the needs. And faith leaders have been regularly convening under the guidance of Dr. Robert Dome through the SFU Centre for Dialogue. As part of these efforts, we are working together with faith leaders to develop an approach to enable the gradual return of in-person religious services. Again, a phased approach in the coming weeks. We know there are many important dates coming up in many faiths, and we are working on how to best safely enable these important and critical celebrations in our religious life to take place. So the focus will be in the next few weeks to meet both the specific needs of different faiths around these celebrations and to ensure that public health measures and safety precautions remain in place. There is much that we can look forward to in the coming months as we look ahead. And I want to take a moment to recognize what has happened over this past year and how everything that we know has been changed in so many ways. This past year has challenged us all, and we've learned that we are stronger and far more resilient by supporting and encouraging each other along the way. Today, as we celebrate International Women's Day, I also want to recognize the many, many women who have been instrumental in our COVID-19 response here in BC and across the country and the world. Particularly my public health colleagues here in British Columbia and across the country, but also the mothers, the sisters, the aunties and daughters who are making a difference every day at work, at home, in their communities across this province. We know this pandemic has been hard on so many, but let's keep building this momentum that we have gained and continue to do our part to keep each other safe and put this pandemic behind us. And I am in awe of all that people are doing and grateful for the work that we're seeing. And let's continue on our path together. And as I heard the other day from a knowledge keeper on the BC Association for First Nations call we had, Robert Joseph, a very wise man, said, "We will celebrate our lives again, dream our dreams again, and watch our children regain their hope." And that's what we can look forward to in the coming months. But let's also continue to be kind to each other, to be calm, and to stay safe.